I wanted to ask one other question, and you mentioned about plasma. And maybe if you can just explain a little bit about plasma. And I'm talking of, my question really is linked to it. If I take plasma from someone who was a COVID patient, can it be used as a preventive measure to use, to create and develop resistance? And second is, how is plasma used? When is it used to treat a COVID patient?
Okay. Again, very good question. So the whole concept about plasma is that suppose I'm infected and I've recovered. I now have antibodies. I donate those antibodies in the form of plasma. So it's called convalescent plasma, plasma obtained from a person who's recovering and has antibodies, and using that plasma in someone who is sick. On paper, it sounds great because you now are transfusing antibodies from a person who is recovering to a person who's much sick and doesn't have those antibodies yet. So on paper, it looks great. If at all, it should be used not for prevention, but for cure in a patient who is having an active infection. Using it for prevention doesn't quite make sense because those antibodies will wane away and will not protect you when the infection comes.
Right.
Now, it's been studied. There's a big Mayo Clinic trial that came out a month or so ago in terms of transfusing plasma, convalescent plasma, in patients who are acutely sick. On paper, it sounded really well, but the outcomes of that study were a negative study. So it's not part of our protocols currently. If someone was on the throes of death and we are trying to salvage and use something that has even a semblance of rationale behind it, we would use it, but that would be under throwing everything you can to salvage a patient. But other than that, we wouldn't use it. And there is unfortunately the data behind antibodies and plasma is negative so far.
Got it. So again, there is no light at the end of the tunnel as far as I see it.